This is the program Transforming Lives One at a Time. I am your host, Deanne, and I want to welcome you to another program. On this program, we speak about matters that are relevant. We aim to find solutions to the many issues we face in society on a daily basis. If this program has been helpful to you, you can touch base with us on our Facebook page, Transforming Lives One at a Time. Of course, subscribe to our YouTube channel, the same, Transforming Lives One at a Time. Today, we will be speaking with a pediatrician as we discuss issues surrounding our children's health. My guest today is no stranger to Tobago, Trinidad, and of course all over the world, Dr. Gillian Wheeler from Tobago. She studied at UWI in Trinidad as well as Jamaica. She did her residency in pediatrics in New York, followed by a fellowship in allergy and immunology. She has board certifications from the American Board of Pediatrics and the American Board of Allergy and Immunology. She was head of the pediatric department for approximately 10 years. Dr. Wheeler is in private practice both in Tobago and Trinidad. Dr. Wheeler, thank you so much for joining us on the program today. It's a pleasure having you.
Thank you for having me.
Yes, my dear. Well, firstly, I know that you are part of a team that initiated sickle cell screening of newborns at the Scarborough Hospital under the expert guidance of the late Dr. Waveney Charles. Also, you started the asthmatic clinic at the Scarborough Hospital in 1997. Just tell us a little bit about these two initiatives.
Yes, well, the sickle cell screening, that was under Dr. Charles, as you said. That was in collaboration with the University of the West Indies and a center in Guadeloupe. And they were very eager to start screening for sickle cell in our country. And they found Tobago was ideal because of, the population. It was Smith's One Hospital.
Yes.
So we were very happy when they decided to work with us as the Tobago Regional Health Authority at the time. That was up at the old Scarborough Hospital. Okay. And initially it was a one-year pilot program. And it was funded by the University of the West Indies and the center in Guadeloupe. And it was taken up by the Tobago Regional Health Authority after that, and it continues to date, which was excellent of them because we are the only region that has consistently been screening for sickle cell since 2008. And we found we have probably about 1 in 10 children in Tobago have a trace of sickle cell.
Really?
Not a full-blown sickle cell, a trace, yes.
Wow.
And maybe 1 in 200 children have full-blown sickle cell. So the screening, is done to all babies that are born at the Scarborough Hospital.
Yes.
They just get a little stick on the heel, and it goes on a little card, and it still goes to Guadeloupe.
Right. Wow.
Right? And I must commend the TRHA for continuing that program because it's important.
Yes.
Because you want to pick up children that have sickle cell early on.
Of course.
Because their medications, they start, their special vaccines they get, and they're followed up in the clinic, and we screen all the relatives, the members of the family, of the immediate family. So it's a good program.
Yes, definitely.
Yes.
I am amazed at the kind of numbers.
Yes, because we're at least 95% of the population of Tobago is of African descent.
Right.
So sickle cell is more common in persons of African descent. You have it in other races as well.
Yes, but it's more prevalent.
More prevalent, yes.
Wow. Well, those figures really, really amazed me there.
Yes.
Well, I would like us to touch on the importance of breastfeeding, especially in the early ages of a baby's life. It has always been touted that breastfed babies are the best babies.
Yes, definitely.
Is that in fact true?
That is very true, yes, because breast milk is special. Your body, God designed our bodies, and the human, mothers are made, they produce milk.
Yes.
And that is the perfect food for most babies. It has antibodies, it has all the nutrients, antibodies that you have in human breast milk You don't have that in formula.
Right.
You can't get that in formula. And those antibodies help to protect you from infection. So if mommy is exposed to someone who has some cold or something, her body starts producing antibodies to that virus. And it comes out in the breast milk and helps to protect the baby. So breastfeeding can reduce the chance that the baby will develop asthma, allergies, eczema, diabetes.
Wow.
And other conditions,
yes.
bowel conditions later in life. And it helps the mother as well. A mother who breastfeeds has a lower chance of developing diabetes, certain types of cancers, and also you can lose some of that pregnancy weight that you put on faster.
Okay.
And it can also help to some point with contraception, and you breastfeed only.
Really?
Yes.
Wow, that's
so
amazing.
It is it's one of the most important things, breast milk. Yes.
Wow. Well, what are some of the things that can be put in place if the baby isn't getting enough?
Right.
And of course, some mothers would say that sometimes it's very painful to breastfeed. The area is very sore.
Yeah. So most mothers are willing to breastfeed, and one of the commonest reason that mothers will start a baby on formula is because they're afraid the baby isn't getting enough.
Okay.
Now, in the first week of life, especially for a first-time mother, the first 3 to 5 days, the breast milk may not flow.
Yes.
What you have is colostrum, which is rich and it's very thick. And it's enough. But God designed babies that, knowing that the breast milk would not be flowing, gushing out in the first few days, babies are born with extra fluid. They're born with extra fluid, so babies will lose weight in the first few days of life. They'll normally get back to how much their birth weight by the time they're 10 days old, 7 to 10 days. But that's how nature designed it.
Wow.
And so that colostrum is not something you'll see gushing out, but you know that the baby is getting it because the baby will suck on the breast. And after that, the breast milk will start to flow.
Right.
Now, you know that a baby is getting enough when, they're sucking well and they go to sleep after. They're wetting their pampers. They seem comfortable. All right, but you mentioned something about sore nipples. And this is important. You have to make sure the baby is latched on well to the breast. So when a baby is sucking, they shouldn't be biting on the nipple. Okay. They should be biting on the areola, which is that dark area around the nipple. And that's where most of the milk is stored. So baby has to work to get that milk out. They have to bite and suck on that area so that the nipple should be way into the mouth. Okay. The baby's nose should almost be touching the breast. All right, so once they latch on well, and you can support the baby, either put a pillow, have to bring the baby right up to the breast to help them to suck well, so that that will help to increase the breast milk. And of course, mommy has to because stress and anxiety can reduce your breast milk. These things can impact, and reduce the amount of breast milk. So you want mommy to be relaxed. Make sure she's drinking lots of liquids. We normally say 2 liters of fluid every day.
Okay.
And mothers who are breastfeeding have to continue to take their vitamins as well. And there is a medication actually that can help if you're doing all of that and still think you're not getting enough, but we really would monitor it by the baby's weight.
Right.
Making sure they put on enough weight, that they're wetting 6 or 7 pampers a day. There's a medication that can help, and we do have a local herb, I can't call the name of it. Okay. That may help with the amount of breast milk.
Right,
so there is babies, help. I want to say babies should breastfeed for at least 2 years. 2 years is a recommended time.
Right.
And nothing but breast milk for the first 6 months. So a baby really doesn't need anything else.
Right, so 2 years.
Yes, it's 2 years.
Wow.
You can go longer than that if both mother and child decide they want to. That's fine. All right, but it should be at least 2 years.
Okay. Okay.
Yes.
And as a baby grows and develops, a mother would usually seek to find out certain things, like when can her baby begin to look at videos? Is there a safe period?
That's a trick question. Looking at screens, videos on TV, tablet, phones is not recommended at all before the age of 18 months.
Okay.
All right, they really unless it's like a video call, a phone call, and you use video, then you can get a baby in that, right? But nothing aside from that. The reason is it's not that they won't look at it, you know, the flashing lights and so on, you know, that will engage a baby's attention, but it doesn't help with the development of their brain.
Okay.
And we realize that babies that especially spend a lot of time looking at screens, it actually interferes with their brain development. So we're seeing problems where babies or young children, you know, under that age, or even toddlers, spend a lot of time looking at screens. Their language doesn't develop. They don't speak as much and as often as you would want. And what they call the intellectual function, the ability to process and so on, is actually affected. So they have problems focusing in school, and in terms of their academics and so on, the excessive screen time, that's what we call it.
Yes.
It has those negative effects, and that is something that we're dealing with and teachers are dealing with now.
Wow.
Right?
So is there, because I'm hearing in education, is it that we have like a system in place that as a child, as a mother gives birth, that they are given these kinds of information? Or support systems, support systems.
You mean advising them about screens?
Advising, yes. But generally, because especially for young mothers, first-time mothers, I would hope that when babies are born, that the pediatricians, the doctors that see them, you normally would give what we call anticipatory guidance. Okay.
You give advice about, you know, put the baby to sleep on the back.
Yes.
That's a safer way for them to sleep. Don't have anybody smoke around them. And, you know, so that would be one of the things that you would want to counsel young mothers and, parents on, right? The family in general. That's something when I see children, you normally have to find out how much time is this child spending looking at screens and counsel about that, because we do have children that are spending hours a day, and you have complications of that. Yes, you know, aside from school, but you know, being overweight and processing and the attention span is short, and
So for the average child, as we are speaking about that now, for the average child, you know, you have a lot of them on the tablets, and many times as they leave and they come from school and they're on the tablets, because sometimes the parents are probably busy preparing a meal, and they just like, okay, look at television or look at this until I get. What is the kind of time frame that is healthy?
So it's 0 below 18 months.
Okay.
And then under probably 5 years, you would say maybe an hour a day.
Okay.
Over 5, maybe could be 2 hours, or you know, it depends on what they're using it for.
Right.
You know, because some children may have schoolwork.
Yes.
And then so you're looking at the outside of the schoolwork.
Okay.
You know, you have to work that out. But children get hooked. Adults get hooked on that, much less for a child whose brain is developing. Right? And the other thing we're seeing is that you have an epidemic of children who are short-sighted.
Yes.
Right? Because they are always looking, focusing right up. Right? So you have to be careful here, and there are limits.
Of course.
There are limits,
Well, I know that's a very
So younger children,
concern.
under 5 in particular, when you're developing language and you know, the brain, you know, your brain is growing so much and it depends on being stimulated.
Yes.
Then you really want to limit the screens. You want to have children having more contact with their environment, with individual persons, you know, outside, playing outside, rather than looking at this flat two-dimensional thing.
Understood, understood. Because these are some of the areas that we take for granted, not realizing the kind of repercussions that we can have at a later date.
Yeah, so, but you know, there are a couple of countries where they're looking at banning devices in schools. Australia, there's, I think, Italy, they're looking at
right.
actually banning because they see the negative effects.
Yes, of course.
Sweden is another one, and that's all in the last few months.
Wow.
Yeah.
Well, yeah, obviously
Right.
it's definitely taken a toll.
Yeah.
So they are checking into that.
Yeah.
Well, Dr. Wheeler, let's shift the focus a bit to the effects caused by the Sahara dust. We're always hearing about the Sahara dust and when is that time, so many precautions to take and that kind of thing.
Yeah.
And of course, sinuses. First of all, explain to our viewers, what is sinuses?
What is sinus?
Yes.
So sinuses is our local term for allergic rhinitis.
Okay.
Right? Rhinitis refers to your nose running, the allergies, if it's allergic. Although
Yes.
with Sahara dust, it can be non-allergic, it's more of an irritant. So a sinus actually is a normal structure. It's what forms your cheekbones. They are hollowed areas, in the face, in the skull,
Yes.
that form your cheekbones and your forehead. And the reason we have sinuses is to really moisten the air as we breathe in through our nose. All right, but we here in Tobago, we call the condition where people sneeze all the time, we call it sinuses. Right, but sinuses is actually a name of a structure.
Oh.
So the medical term for that condition is allergic rhinitis, or the ENT doctors may say rhinosinusitis. So that is not a normal condition. I have many patients who, when I'm asking about sneezing, they said, well, the normal sneeze,
Yes.
the normal thing. I say, but okay, unless somebody think black pepper in your face, it's not normal. And, that is actually a medical condition, but it's so common that we had done a survey, I think it's about 1 in 3 teenagers and 1 in 3 persons may suffer from sinuses.
Really?
Right? Yeah, so it's so common, and it's the sneezing, and that could be allergies from dust in the house.
Yes.
So the Sahara dust can affect people who already have that condition, but Sahara dust can affect anyone, because it's literally, it comes from the Sahara, comes over, they have Sahara dust all the way in Florida, they have it all the way in Europe. It's just, and it's been getting worse over the last few years, maybe because of climate change.
Okay.
The worst time of the year is between April and August, but for 2024, and I think back in 2019, we had Sahara dust for most of the year. So it's really, the dust, people, you can see it coating your car. So, if you think about it, when you breathe it in, it can irritate your eyes, it can irritate your nose, it can make you sneeze, make your throat scratch. If you're asthmatic, it can cause wheezing. And, so it is a problem. A lot of people are being affected by it. And if you already have sinuses or allergies, it makes it even worse.
Okay, because I was just about to ask, why do you have the sneezing and the scratching of the eyes when the Sahara dust is present?
Yeah, because it's actually literally, there are particles that get into your eyes, that get into your nose, that get into your lungs. And the further the Sahara dust travels, because remember it's traveling thousands of miles.
Yes.
You have smaller and smaller particles that really can get down into the same places that, if you had allergy to dust mite or pollen or pets, it's small enough that it can affect those areas, get into your nose, get into your eyes. Yeah.
Wow.
And the Sahara dust is actually important because it brings iron and minerals, and that deposits on the land, and, like in the Amazon, and it helps to fertilize the land. But even live things can come over.
Right.
Fungus and bacteria and allergens, things that can trigger allergies.
Yes.
Yeah.
So you have to be
You have some good and you have some bad.
That's it, because I'm thinking it's good for the land, but it's bad for us.
It's good for the land, but it's the degree. It's so much.
Yes.
Yeah.
Definitely, because I would usually hear whenever it's time for the weather news, they would be warning, okay, the Sahara dust, take your precautions. And for a lot of persons, they stay even indoors.
Right. Well, that's the negative one. That one of the bad things about it is If you're susceptible and you have to stay indoors now, if you have so many days where the Sahara dust levels are high and you really should be inside, it means you're not outside. But remember, being outside is important.
Of course.
To spend time for vitamin D, which is important. It's important for children to be able to play outside. So you always have to balance, how am I going to approach this now?
Wow.
Right?
Well, at this time, we're going to take a short break. Viewers, we're going to take a short break and we will be right back. Stay with us.
If you're wondering where to find top-tier quality tiles and products to refurbish or renovate your wall, floor or pool, well, your worry is over. Come to D-Cells Tile and Ceiling Center, Store Bay Local Road, opposite the Bonnecourt Primary School, Tobago, where you will find porcelain, mosaic and ceramic tiles of the highest quality guaranteed. D-Cells Tile and Ceiling Center also stocks thinset, grout, tile cutters and yes, windows. Plus a friendly smile and service that's second to none awaits you. So forget the hassle and get all the quality tiles you need right here in Tobago at D-Cells Tile and Ceiling Center. Call us today at 460-8802, 639-8281. Opens Monday to Saturday from 9 a.m.
Welcome back to the program Transforming Lives One at a Time. My guest today, pediatrician Dr. Gillian Wheeler. Well, Dr. Wheeler, just before the break, we were talking about the effects of the Sahara dust as it relates to sneezing and scratching of the eyes and stuff. What are some precautions persons can take to safeguard their health in this area?
Right. So if you know you're sensitive, you want to pay attention to the weather, the forecast.
Okay.
And if there will be a heavy or moderate Sahara dust, so on that day, you probably wouldn't want to plan to go to the beach or, outdoor activities. There are times when you may want to wear a mask, depending on if you have to be outside for some persons. There's medication that you can use, an antihistamine. If it's the sneezing and the itchy eyes, you can take it as preventative.
Okay.
For persons who have more chronic symptoms, sometimes some people may need actually nose sprays that they use on a regular basis to prevent if it's, they're having daily problems, sneezing and stuffy nose and itchy throat. And asthmatics should also make sure they're using their medication as well, because it can affect asthma.
Right. Well, I was just going to shift to asthma. When we hear someone is asthmatic, what does that mean? And if your child is wheezing when they have the cold, would that child be considered as asthmatic?
Right. So that's an excellent question, because children are small. So asthma is something that affects the airways, the breathing tube. So when you breathe in through your mouth, the air goes down the windpipe, then it goes into these tubes that are just like pipes, you could say, that transport oxygen. So those tubes are sensitive, extra sensitive in persons with asthma, where they can go into spasm. And then when they go into spasm, the space for the air to pass is smaller. They get narrow. And that's when you can hear, if someone may cough, or you may hear this whistling sound that they make, all right? So that is really asthma. So when you have babies and young children, they are smaller, so their lungs are smaller. Okay. So those breathing tubes or the airways are smaller. So if they get the cold, and when you have the cold, you have a lot of mucus, your nose runs. So in those airways produce mucus as well. So because they're so small, it's very easy for them to get blocked. And then you can hear that whistling sound and have wheezing. So that is something that can happen to babies and young children. So if that happens, you wouldn't say that someone that age, under 2-3 years old, is asthmatic unless it's been happening repeatedly. And maybe, mommy is asthmatic, daddy is asthmatic. Maybe even in between having the cold, when they run around, you see them short of breath or they're coughing, then you may say asthma. But children under 3, simply because they're small and the airways are small, they may have wheezing when they get the cold or the virus. And we try not to, we don't label them asthmatic. generally, unless they, they meet those other conditions.
Okay. So what are some of the precautions parents can take to safeguard?
So, right. So if they are asthmatic, or if they've had wheezing, because we use the same medicines to treat those young children as the same medicines that you would use to treat someone who has asthma.
Okay.
So one of, it's commonly the virus. So of course the average child will get the virus once a month, sometimes twice in a month, like between September and February, sometimes twice in a month they can get the virus. And coughing may be part of that. You can make sure they get their flu vaccine, because flu is much worse in children who are under the age of 5.
Yes.
And that will prevent influenza, which is just one virus, but it's one bad virus, because you can end up in hospital and, children can die as a result of that. You also want to, of course, the usual hand washing and young children under 3, we don't recommend wearing a mask, but hand washing or staying away if you're sick. But children are in school, so they're constantly being exposed to the virus. If they do have wheezing, they may be using an inhaler, so they should be seeing a doctor to advise how to use the inhaler, when to use the inhaler. Some children may have to use an inhaler every day to prevent, if it's happening often, to prevent it from happening. And make sure they have fruits and vegetables every day. Look at me when I say that's where the vitamin should come from, the vitamin C. And so those are some things that they can do, because even if a child has asthma or is wheezing, you want them to be able to go to school. You want them to be able to take part in any activity that they want to take part in. All right, so you don't want them missing school. If they have to be on something an inhaler every day, that's fine, because you want them to be able to take part in sports.
Yes.
And remember, there are Olympic athletes who are asthmatic.
Of course.
And so you want the child to be able to do everything, even though they have asthma. One thing that asthmatic children can have, one of the early signs, is coughing. That's worse in the night or early morning when they wake up in the morning coughing. That happens even before wheezing. So when a child has that cough, and they do seem to have the cold or so, or the cold can make it worse. That's one of the signs, that maybe the asthma is active, that you have to pay attention.
Okay.
All right.
All right. Yeah. Well, Dr. Wheeler, you are very aware that this next issue has and continues to be of grave concern among parents, teachers, health practitioners, and of course the authorities within the last few days, and I'm not sure weeks. We are talking hand, foot, and mouth disease. Just explain exactly what is this disease and the symptoms to look for.
Yeah, so literally hand, foot, and mouth. It is a virus. It's a virus that causes a specific, it has a name because of the symptoms. So it can start off with like a regular virus, maybe with some fever, some runny nose, some cough, and then after a couple of days, you can see either some spots, red spots in the mouth or on the lips and on the hands and the palms, on the soles. Sometimes they can spread even to coming up the legs or further up the hands or even on the buttocks.
Right.
And what's different about this rash is that, they look like red spots and then they form almost like blisters or an ulcer. All right, so, and in the mouth, it can be quite painful. So with a child, if you think about when you have a canker sore, it's painful. And you have these different spots in the mouth, it may be painful for them to swallow and to feed, and if they're having fever. So that rash, that's why we call it hand, foot, mouth, because it's the mouth, the palms, and the soles predominantly where you will have the rash. It is a virus. Unfortunately, there are two main families of viruses that can cause hand, foot, mouth. And so there are different viruses even in the family, so you can get it more than once.
Wow.
Because people have called, you say, but just had it in December and then in January. And yes, unfortunately, you can get it more than once. It's quite infectious, and it's spread by the usual way viruses spread. You sneeze or you cough, and it goes into the air, someone will catch it.
Yes.
You get it on your hands, you touch it, gets on surfaces. So anyone coming who touches can pick it up. And it's commonest in children under 5. I mean, any age can get it, but those under 5 are the ones that will develop the symptoms. And who are the children under 5? Where are they? They're in preschool, maybe you're in daycare. So they all sharing. They're not very good with the hand washing and everybody hugging and so on. So that's why it can spread in those types of settings.
Right. Because I was about to ask if they could get a second bout of it, but of course you answered it. But is the disease like chicken pox?
It's different to chicken pox. It's a different viruses. It's similar in the sense that when you have it, you really should stay at home until everything is all cleared up. A very small percentage of children may end up having to be admitted to hospital, but it's usually mild, that they don't really need to go unless you're not sure what it is, for a doctor to see and to confirm, well, this is what it is. Chicken pox is a different virus. You have the chicken pox virus, which causes chicken pox. And it's transmitted in a similar way, quite contagious as well. Someone with chicken pox would be sick for a couple days before you see any rash. So they may start out as if they have a regular cold, and then only then you may see these little blisters. But those blisters start, some maybe on the chest or the back, or and then they spread outwards. So those blisters don't start in the same way. You may get things in your mouth, yes, but those would come after. And usually it may not be the palms, that would come after. So how it starts and where the spots start can tell you the difference between chicken pox and hand, foot, and mouth. Yeah, and then they're really like, little blisters with a little bit of redness, and then they dry eventually. They probably will dry up in the same way.
Wow. So as we continue the discourse about hand, foot, and mouth, I think the main question for all the parents is, how do I protect my child? Just share with our viewers.
Well, that's a good question, because if the children are in preschool or daycare, they're exposed to other children. So in terms of the daycare or the preschool, if a child gets ill with one of those conditions, it means everyone was exposed.
Yes.
And then they may need to send everybody, either monitor, if it's chicken pox, you can monitor the children, if they keep coming, for anyone who falls ill. But if you see, a few children falling ill, it may be, those children have to stay home, because you really need to stay home until the rash is completely dried up. All right, which would be a week or maybe a bit more than a week.
Right.
Usually, But in that age group, it's
almost impossible.
Sanitizing, children, after they will see each other, they will hug. And so it's really the place where they spend time in terms of sanitizing and picking up if a child has something that's not the regular cold, that for them to stay home. But if you see a rash on your child, you need to keep that child at home and let the daycare or the school know that the child is ill, so that they can look out to see if anyone else has
Of course.
And of course having fruits and vegetables, so you have your immune system built up, playing outside, getting sunlight, and so so that the immune system is as built up as it can be.
Yes, at the maximum.
Yeah.
So once a child is exhibiting any or all of the symptoms you shared, should they seek immediate attention? Or just they could just stay home and the parent could just take care of?
No, if it's hand, foot, and mouth, if they're comfortable with what it is, and I have Google to see what the pictures are.
Yes.
If it's mild, you really don't need to see a doctor unless you want, somebody to confirm that this is what it is. That's for hand, foot, and mouth. If a child has high fever, and they're not feeding well, it may be good for them to be seen, in case they may get dehydrated. If they have those painful sores in the mouth, and you can give paracetamol, you can give a painkiller like paracetamol.
Yes.
You can give them cold fluids, nothing acidic or anything, hot things that will aggravate or make it more painful. But if you're trying to get them to drink and they're not drinking enough and they're at risk of being dehydrated, they need to see a doctor then. All right. If it's chickenpox, now, because there is a vaccine for chickenpox that can prevent chickenpox. Okay. And actually, if you are exposed to someone with chickenpox and you've never had it, and you can actually get that vaccine, it may protect you if you get it within 3 days of being exposed to someone with chickenpox. With chickenpox, I would advise that you see a doctor, because that is one of the conditions that you'll see when you go to university or college.
Yes.
They may want you to have a chickenpox vaccine, or they want you to know if you had chickenpox. So it really would be good to have it on record that you have chickenpox. So you may want to see, of course, let the doctor's office or the clinic, wherever you go, know that this is what you're thinking, so that they can isolate you when you come in.
Yes, of course.
But you may want to see some. And there also is a medication that you can use for chickenpox, but you have to start it ideally within 24 hours of seeing the first the first spot on the body, and you will be able to get that from a doctor.
Right. As we continue to talk about hand, foot, and mouth, and of course chickenpox, I'm thinking in terms of when a child contracts it. If a child contracts it, and they're at home now, is it that child has to be isolated from the rest of the main family, and then you have like one caretaker, or how does that work in the home environment?
Families, they do try to do that actually. The thing is that when you see the first spot come out, the person would have been infected for about 2 days or so, 3 days even before that. Wow. So persons in the family may already have been exposed. And that's if they were, if maybe the child got it from someone from school, or maybe a parent got it from someone at work. And, if they know that there was someone at work, so sometimes that may work, but not always, and recently I had a case, one child had it, and immediately they separated the children, but then the other child came down with it, because, you wouldn't know until 2 days, and it's already been spreading.
Wow.
Yeah.
Well,
but you can try, because there are people you want to protect from chickenpox. Pregnant women,
right?
Very young babies. And
actually,
adults is worse. Chickenpox is worse in adults than in children. People worry about their children.
Yes.
But I tell persons, I said, chickenpox is worse in adults than in a child. But there is a vaccine for chickenpox.
Okay.
To prevent,
Right, wow.
So persons can explore that at a time like this. I mean, if you've already been exposed, you may just have to wait out the 2 or 3 weeks. But
2 or 3 weeks?
Yeah, the incubation period could be 2 to 3, up to 3 weeks. Usually about 2 weeks or even less.
That's a long time.
Yeah.
Especially having so many persons in the home.
Yeah.
Most times you have one washroom. Everybody's using the same washroom.
If somebody's come down with chickenpox, usually that will clear up in maybe a week and a half, a week. When all the spots are dried up completely, then they no longer would be infective. So that could take maybe a week and a half. Yeah. But to know if you got chickenpox, it takes about 2 weeks to incubate before you know if you had it, before you show signs. Yes.
Wow. Oh my gosh. Well, just before we head into another break, but I wanted to get back on the sickle cell just a bit. That kind of hit home for me. Because just late last year, I had a cousin that died from that. Well, I can't say she had that.
Yeah.
And so that complicated a lot of things, and it was a very traumatic time. And then she had a son who had that as well, and he would have passed a couple years before. So when we spoke about that initiative to be able to start that screening, yes. I felt really, really good that we are actually trying to nip it in the bud, so we'll be aware of what is happening, so we'll be in a better position, because if we have the information in advance, yeah. we know exactly how to treat and which yeah. child to treat, so that it would not be it would not come to this end. Yeah. We'll be in a better position. So I just remembered that, and I'm really happy that they continued the project.
Yeah, screening, yes.
Yes, they continued the screening.
Well, what that does, it tells you if you have sickle cell disease. But then you have, there is a medication now that most adults should be on right now to help, but it doesn't help everyone. But there are some new treatments for sickle cell. Okay. Maybe not in Trinidad and Tobago, but there are new advances. I know just about sometime within the last 2 months in the UK, they announced that, in their health insurance, in their health system, that there's other treatments available for sickle cell, because you can have persons who have mild sickle cell yes. disease and those that have severe sickle cell disease. And the persons with mild and more moderate would respond to the usual treatments that you would give. But those on the severe end would probably benefit from some of those additional treatments. But there are things that can be done, yes.
Right, yeah. And of course,
so
early
that
detection.
Can live, yes, definitely early detection. Because you do start on medication, infection is one of the major issues with sickle cell. So yes. you want to make sure they have all their vaccines,
yes.
That they follow up and they see the doctor regularly, if it's every 3 months or twice a year, depending on how, as they get older.
Yes.
So there is hope for sickle cell.
All right. Well, I am
so
very,
that you don't have
happy.
the complications.
Yes, later on.
Later on, and that can really lead to, whether it's ulcers or kidney problems
yes.
and all the different parts of the body that can be affected.
Right. Well, that is really, really applaudable and wonderful to hear. At this time, we're going to take another short break, and we will be back. You're viewing Transforming Lives One at a Time. Stay with us.
If you're wondering where to find top-tier quality tiles and products to refurbish or renovate your wall, floor or pool, well, your worry is over. Come to D-Cells Tile and Ceiling Center, Storebay Local Road, opposite the Bonnecourt Primary School, Tobago, where you will find porcelain, mosaic and ceramic tiles of the highest quality guaranteed. D-Cells Tile and Ceiling Center also stocks thinset, grout, tile cutters and yes, windows. Plus a friendly smile and service that's second to none awaits you. So forget the hassle and get all the quality tiles you need right here in Tobago at D-Cells Tile and Ceiling Center. Call us today at 460-8802, 639-8281. Opens Monday to Saturday from 9 a.m.
Welcome back to the program. We continue the conversation. Dr. Wheeler, just before the break, I know we are talking about a lot of different things, but I wanted to go back to the issue of asthma and sinuses and persons treating with those. What are some of the measures they can use at home?
Right, so the home environment is important because I mentioned, there are irritants, things that can trigger, and this is persons with sneezing, stuffy nose, and also asthma. So simple things like insecticide sprays, air freshener sprays, plug-in air fresheners,
yes.
Scented candles, Coxet, those mosquito coils, all of those are things that can trigger persons that have sinuses or asthma. Stuffed toys,
yes,
some children
yes,
have,
yes.
because dust, people tell you house dust is one of the things that will make them sneeze or make them cough. So stuffed toys, carpets, rugs, blankets and comforters. What? I'm seeing so many people now. It's a battle now with blankets and comforters, and they're allergic to dust mite.
Yes.
Which is something that's alive. It's microscopic. You can't see it. But 90% of persons that have allergic rhinitis is sinuses. They're allergic to dust mite. So your blanket and your comforter, you have dust mite in it. And then the AC, people tell me they have the AC at 16 and 17 degrees. Those cold temperatures actually make the nose worse and the coughing and so on worse. So the lowest temperature for the AC for the night is supposed to be about 25, right? 24, 25 degrees. Cigarette smoke, marijuana smoke, vaping, all of those things can aggravate asthma and the sinuses as well. All right, and pets inside, like cats and dogs.
Of course.
During COVID, people brought rabbits inside. So you have persons who are allergic to rabbits. You can have allergy testing and see what persons are allergic to. So the indoor animals, not those furry animals, not a good idea. So pets for families where you have asthma and, allergic rhinitis. Most persons, I find, if you have a dog outside, persons with allergies and so tend to be okay with that. The problem is when you bring the dog inside. All right, so that's okay. And if there's a family where there are no children under the age of 6, then you could have turtles as a pet.
Okay.
Right, yeah. But under 6 is not safe to have pets, animals like turtles. You can't get salmonella poisoning, children under 6 years of age.
Really?
Yeah.
And I actually have a neighbor that has a turtle as a pet,
But once they're over 6 years of age.
No, there's a little child, he's about 2.
Well, they have to make sure that that child never touches the turtle.
Really?
And that if they handle the turtle, that they wash their hands and so on after.
Right. Well, I will definitely relay that information.
Yeah. Right.
But it's so amazing, some of the things that you spoke of. Some of the things that we just take for granted because your blanket, sometimes you would just spray something, and even those plug-ins.
Yes, the plug-ins.
This is something that we have all the time.
The mosquito coils and the AC. I have a part, the air condition, yeah. So the air condition is fine, it's really hot these days.
Yes.
So you can have it to keep comfortable, but you can't put the AC at 16 and cover up with a blanket.
Yes.
Right?
Well,
so we say you cover with the
guilty of that. I am guilty of that because normally my AC will be on about 18 to 20, and I would just go to sleep, and sometimes I would wake up and like, oh my gosh, it's so cold, I don't even want to take off the blanket to take off
the so when I see children who they've been accustomed to that, and then you realize that they have the asthma or the nose and then it's a real battle for them to give up the blanket. And they have all these pretty blankets now, and you're seeing little babies now with these very thick blankets, not the thin blankets for the heat, but these thick blankets, right? So it's when children get accustomed, it's hard for them to give up. So, you want to try to avoid those. Like we're in the tropics.
Right, exactly, true.
Right, we're in the tropics.
Wow. Yeah. Well,
so those are things that that can be done from the time you see a child starts having, wheezing or sneezing and so on, measures to put in place.
All right. Well, those are very good measures, definitely.
And in terms of diet, I mentioned fruits and vegetables every day, which is where you should get your vitamins.
Yes.
Which is that helps your body to deal with the sinuses, immune system. It strengthens your immune system. And there are some snacks that can aggravate those conditions. I'm not going to call brands, but those yellow, cheesy things that children love. They come in all different shapes and all different names. Those actually can aggravate asthma and sinuses. So I don't say never, but you really want to cut back if it's once for the month or twice for the month for the most.
Oh,
all right, those specific types of yellow, cheesy, puffed up snacks.
We got it.
Yes.
We got it. So we know exactly what to lessen down on and what to increase.
Yes.
What to increase in. Yeah. Well, Dr. Wheeler, as we begin to wrap up the program, I would like you to touch on the common cold that our children will face from time to time. As you indicated earlier, sometimes twice per month a child would have a cold, and it's like, it's so, at the end of the day, it's like, just now, you have the cold again, that kind of thing. How critical is it for parents to continually build up their child's immune system, and what other precautions can they take?
So it's, I said it's the average once a month from babies up until, by the time a child is about 6, then it's much less common, because by then they've been exposed to many of the viruses.
Yes.
So I mentioned breastfeeding. You know, babies that breastfeed don't get sick as often.
Okay.
And you know, even if a baby who's breastfeeding gets ill, you know, they will still want the breast, but if it's a bottle, they will push it away.
Yes, yes,
right?
yes.
So the breastfeeding is important, you know, fruits and vegetables. The flu vaccine is important, but that is just specifically for influenza, which is not the common cold.
Right.
Because you can get quite sick with influenza. You know, hand washing, you know, sanitizing. In the slightly older children, you know, if they're over 4 or 5, I say, you know, if they're sick and if they go to school, and they're coughing a lot,
Yes.
they really should wear a mask.
Right.
You know, so that they don't get
Of
the
course.
other children sick. But it's really fruits and vegetables every day, which is where you get your vitamins. There's no
Right.
special outside of that. You know, you don't need to go and buy a bottle of vitamins or some vitamin syrup. No, you know, you
Right.
get fruits and vegetables, vary the diet, try not to be around persons who are sick, but you know, children will be in school. But you know, it's not every time that they get the cold that they get sick. Many
Yes.
children I see, they have a red throat, they have the virus, but they have no symptoms.
Right.
Right? So it's not, but they're children who, you know, every time
Yes.
they seem to come down and they're coughing. And you have to be careful that it's the virus and not the sinuses.
Okay.
Because you'll have children who have sneezing and they have runny nose and it's going on for 3, 4, 5 weeks and it's always clear.
Yes.
That's not the common cold, that's sinuses. Because when you have the cold, you will get better, you know, in a week
Yes,
or 2.
of course,
and
of
then
course.
everything is fine. And then you may get sick again.
Yes.
Right? But so you have to be careful that it's not actually sinuses or allergies.
Mm-hmm.
That's true, because sometimes it's not easy to tell
Yes.
what the difference is.
Wow. Well, Dr. Wheeler, I have a 3-minute window here as my time is quickly approaching. I have a 3-minute window here. Is there any other area you would like to address that you think is very crucial as it relates to our children's overall care and development and health?
Yeah. Well, I think people, you know, childhood, it's gone in such a short period that you want to enjoy. You want to enjoy your babies,
Yes.
enjoy the toddlers, no matter they're saying no and they're having temper
Yes.
tantrums. And because the time passes so quickly.
Yes.
And watch them with those devices and the internet. The internet access, be careful with the internet. That you know what's the older children, what sites they're going to. You have to really be vigilant in terms of that with what's happening in the world today. And the other thing I want to touch on is their spiritual health. You know, children, especially in these days, that they know, you know, for me, that there is a God, that you know what is right, what is wrong.
Yes.
You know, being kind. And having that relationship with God, I think, is most important for the parents to show and for the children to learn from, you know, from young about that. I think is most important, especially in the world that we're in now.
Yes.
Yeah.
Because many times we think about their physical health. We're just
Right.
thinking about the foods they eat, about them
Right.
getting enough exercise, about so
Yeah.
many other things, and we neglect
Yeah.
that spiritual aspect.
Right, and their development, you know, children should play outside, have
Yes,
time outside. All
of
the children
course.
inside all the time. Have that. That's important for children to be able to
Yes.
just play with each other. That's important, an important aspect of their development.
Yes, definitely,
well.
definitely. Well, if there is one key takeaway from this interview you would like to really allow our parents to get, what would it be?
I would say, love your children, enjoy the time with them, embrace them, allow them to be who they are. You guide them,
yes,
but allow them, every child in a family is different. You have 3 children and they're very, very different.
Totally.
Try to learn your child and allow them to express themselves,
Yes, that is very, very important. So we have
Yes.
well-rounded children.
Yes.
We are not just thinking about their physical health, but we are thinking about them, how they interact socially, their emotional health, their mental health, their spiritual health. And with that, you have a comprehensive approach.
Yes.
So when we say we have healthy children, or we are looking to produce healthy children, we just cannot look at it from the physical alone, but we have a holistic approach.
Exactly.
To ensure we have well-rounded children.
Exactly, yes.
Definitely. Well, Dr. Wheeler, I would like to thank you so much for coming in today. I know you would have taken time off from your busy schedule, I could only imagine. Dr. Gillian Wheeler, she shared so much information with us, pertinent information, and of course we are grateful, and I'm hoping that we can be able to call you anytime to be able to make a tack back on the program. Well, folks, this is how we wrap up the program for today. This is Transforming Lives One at a Time, and of course we seek to be relevant. We seek to provide solutions. If there is a topic that you would like us to discuss on the program, feel free to send us a message on our Facebook page, Transforming Lives One at a Time. Of course, on our YouTube channel, the same, Transforming Lives One at a Time. Well, Dr. Wheeler, I want to also encourage you. You have been, as the name of the program suggests, you have been transforming lives one at a time in your sphere of influence, in your neck of the woods. And I want to encourage you and to thank you for your continued love and commitment to the people of Tobago, to the people of Trinidad. Sometimes we tend to overlook and say, well, okay, this is their job. But no, at the end of the day, you have the passion, you have the heart to do it because you really want to help persons and to see lives being transformed. So I want to say publicly, thank you for your service and your continued commitment to the cause and keeping Tobago's children healthy and safe.
Well, thank you for that. God has blessed me.
Yes, indeed. Well, viewers, this is how we wrap up the program for today. And starting from the month of April, we will actually be bringing the good news segment where you will have an opportunity to send in your good news for just about 2 minutes. But of course, I'm going to share a little bit more about that as the time continues. All right. As usual, I leave you with the definition of transformation, which is an internal shift that brings us into alignment with our fullest potential. Hey, we've got this. See you next time.